Built Better, the podcast for home improvement contractors by Modernize Home Services.
On this episode of the Built Better podcast, we're welcoming Medical Alert Pro Sombit Mishra, CEO and founder of QMedic. Take a closer look into the aging in place demographic, the opportunities that are coming forth, and the ability to use partners as a way of growing your business. So QMedic, it's a 24/7 proactive medical alert service that intelligently routes and escalates alerts to optimize care management for high-risk patients living at home with proactive technology developed by MIT scientists. How fancy. The QMedic's mission is to help homeowners age safely in their home. So, like I said, we've got Sombit Mishra, CEO of QMedic, with us today. Sombit, thanks so much for being with us.
Thank you for having me.
How is everything going in your neck of the woods here today? You're based out of the Northeast?
Yeah, based out of the Northeast. It's raining here, so I don't know if the weather is as nice as it is in Austin, but we manage we manage up here.
Yeah, it is rainy season in Austin, so it's nice and humid, just helping my hair with all the volume, as you can see. And we also have with us today Chris Pallatroni, as usual. He's our co-founder. How's the day treating you there, Chris?
Day's been great. Yeah, we don't have any rain, so we're in California. It's been lovely, and I'm super excited. I've spent the last hour here perusing this topic here, so I can't wait to learn a little bit more here.
Yeah, absolutely. This is another segment in our Aging in Place series here that we're doing for the Modernized Built Better podcast. And so, to start kind of from the beginning, just to level set a little bit with you, Sombit, how was QMedic first established back in, I believe, 2010, and how's it evolved since then?
Yeah, no, it's obviously been an interesting 11 years now. 2010 was kind of the perfect storm for a company like QMedic. And the reason is because there were a couple of things that were converging at the time. The first was you had the cost of sensing technology and micro PCBs coming down so substantially where you could actually have smaller form factors in wearable devices than ever before. And so it was kind of the time you saw products like Fitbit coming into the market. At that time, there were companies like Jawbone. A lot of them were focusing on the wellness end of the spectrum. And I think what we saw was an interesting convergence business-wise with a couple of things in market trends. The first was Obamacare. Without a doubt, one of the biggest catalysts for a company focusing in home health, because Obamacare dramatically expanded Medicaid and was really kind of incentivizing insurance plans and managed insurance plans and Medicaid and Medicare Advantage to take a more proactive approach to the home, to incentivize technologies that kept people out of the emergency room, reduced readmissions. And so that was kind of the policy legislative catalyst. And then the third, which you guys, I'm sure, talk about a lot, is the baby boomer boom, which interestingly, 2010 was the first year when baby boomers turned 65. So the oldest baby boomers turned 65 in 2010. The last baby boomers will turn 65 in 2025. So we're kind of coming up right into that period. And then you have COVID, obviously, which we can get into, and how that's kind of affected the dynamics in the industry. But I'd say that those three factors, and the fact that I was able to meet two really awesome and smart co-founders at MIT when I was there, kind of combined to introduce QMedic into the world.
Yeah, thanks for that background. It's I don't get to talk to a lot of MIT scientists, so or let alone start companies with them. I would love to learn a little bit more about that process, just starting the company up. Just kind of it seemed like you identified a real business need, right? So you got baby boomers aging in place. There's a huge demographic that's shifting over. So you've got the catalyst, kind of the need there. For a lot of our listeners, they're contractors and they're setting up their new businesses, right? There probably is some parallels, just in setting up that startup phase. Do you have any insight there that you want to kind of share with our listeners?
Sure. So my background is as kind of a product guy. I've been a product guy through and through for web and mobile devices and services since the beginning of my career. And I think that when I think about what that means as a product person is that I really believe strongly in observational learning. So to kind of answer your question specifically, the co-founders met. I was in the business school at MIT with my co-founder, Dave Nelson. And then our third co-founder was at the Media Lab. His name is Fouad Al-Banali. He has a PhD in computer science and electrical engineering and was working on some really interesting projects that combined accelerometry with, doing remote sensing in a lot of more controlled settings. So doing it in a research capacity. And I think that when we came together, there was a meeting of the minds around there needs to be a simpler way for us to introduce sensing technology into the home. Right now, at that time, it was very cumbersome. If you wanted to have to monitor or track anything, it was very obtrusive. And I think that what we learned very quickly in the market is that, for the demographic we're targeting, people don't care about data. In fact, I'd say that if you focus so much on the monitoring aspect of it and tracking specific data points, you kind of run afoul of what many people consider as, maintaining their privacy. And so I think the way we went about it was kind of organically learning. So Dave and I spent a lot of time actually just installing systems in people's homes before the systems were even ready. So, before we started selling product into the market, we were like, hey, we'll do the kind of the old school thing of we'll pay you a gift card. You use this device. You tell us what it's like. We kind of observe you in some cases. And so, he and I would literally do hundreds of these where we were testing beta products in the home. We would look for things not just about like our product and how people interacted with our product, but what are the challenges that people are facing day to day? People who have 3 or more chronic conditions. So say you have COPD and congestive heart failure. What are the things that you need in your day to make your life a little bit better? And some of those things are medical devices, and some of those things have nothing to do with medical devices. They have to do with, how much social support do you have in your family? Are you close with your kids? Is there friction there? So there's kind of emotional needs that need to be thought about. There's form factors. So, is the device bulky? Does it give people a rash? For people with macular degeneration, which is very common at that age, are they able to see things if there's a screen on it? So all of that kind of informed our thinking. And I think what we converged on in terms of what would pass the test of something that could be sold into the market were really 3 factors. One was simplicity. We at the very beginning knew our service has to be completely simple. And the way I define that is it can't require members to have a user manual. If they have to read a user manual, they're not going to do that. And that's true not just of older adults. It's true of people younger. And so nobody wants to read a manual nowadays. Nobody wants to read terms of services. We all kind of skip over that. We check the box. We deal with whatever comes after that. And I think that that's something that was very important to us. And I think it's how we've always measured our success on the simplicity metric is, does someone have to read a manual? Do they have to call us and then kind of ask a bunch of questions? Because if they have to do that, that's tying up customer service that could be better spent on, the actual needs of the user. And then I think the other 2 factors are affordability and connectivity. So I know that when I was speaking to Troy, a lot of the people that you guys are in your audience are familiar with this industry, which is the personal emergency response medical alert industry. And I think one of the things that we saw, in the 40 years of this industry is that, pricing, the kind of base pricing hasn't changed substantially. It's always been products that are sold, whether to a consumer or institution, between $30 and $50 per month, depending on what types of features are incorporated into that. And I think what we were really interested in is delivering advanced technology, but not necessarily changing the base price point. So I think, as feedback to anyone who's entering into this industry and really trying to sell home services, whether to consumers or to other institutions, is kind of thinking through that pricing strategy is very important. And I think we're very proud of the fact that, on average, even though we sell primarily to managed care, not to consumers, so consumers don't really pay out of pocket for the majority of our business, I think that we realize that there are kind of affordability constraints in how you think about introducing products at scale into market. And then the third thing, which I think kind of speaks also to kind of where the technology was at the point in 2010, is you really saw a maturation not just in wearable technology, but also the cloud. The fact that you could now do really advanced computation that for 30 years of this industry of personal emergency response just wasn't there. So like the companies that started 30 years earlier, I give them all the credit in the world. I tip my hat off to them because I feel like we stand on their shoulders a bit in the fact that they didn't have the cloud when they started. And I think that why 2010 was such a transformative year was because of all of the opportunities that kind of came with scalable cloud computing. And, between us and a number of the companies that started out of MIT and elsewhere that year, the amount that cloud has transformed these industries is tremendous. And I think what's interesting is that healthcare has always been about 20, to be generous, it's about 20 years behind every other industry. And so I think we were conscious of that in how we developed product as well. So hopefully that answers the question of, maybe that's helpful to the audience a little bit about, how do you enter into a market like this?
I love that perspective on it. I'm sure you have flashbacks of what it's like to be a startup and doing all those things yourself. I think that's great for how you guys did it. I'm a little curious as to why you chose this particular industry. I mean, I understand like some of the rationale you gave, but I don't know. It just, for me, it feels like for a young guy to be looking at an industry that is to help older people. I'd love to understand like what was the rationale for you to say this is the particular problem that we want to try to solve?
Sure. So there's the personal aspect, which is I came from a healthcare family. So my family kind of worked in the healthcare business for their professional lives, my parents. And so I think that I saw kind of a broken industry up front where, between the whole revenue cycle of how providers kind of handle payments from insurance, as well as kind of the patient side where you have people who are, getting increasingly sick and the opportunity, I think, to see between the gaps. So I think what you see with a lot of the technologies that have been in the market prior to that time, there was kind of a black box. You couldn't really see what was happening between visits to a hospital or to a clinic. And I saw that as problematic, is that there's so much that can be evaluated between the visits that you could help that person more proactively. And I think that was kind of the personal side of, kind of filling in those gaps was because something that I was very intrigued by. And so that's kind of one of the things I think at the time, I was very enamored personally with kind of how Obamacare was going to transform the landscape for low income and, higher risk members, the frequent flyers to the emergency room. I felt like everyone was focusing on the younger side of the market, not just in healthcare, but, other technologies. A big focus of my classmates at MIT at the time was energy sector. And I think for me, I was like, well, that's not something that I kind of, while it's important to me, it wasn't something that I was really passionate about. Whereas this was a sector where I was like, not many companies, kind of to your point, like not many people and not many companies were focusing on the older segment of the market. In fact, I feel like even today, it's a segment that gets neglected a lot of the time. And I think that's why I found that particularly attractive. And I think as we dug into it more, and just talking to members, I mean, our average member has 3 or more chronic conditions. Many of them live alone. So social isolation is a huge issue. I think you just kind of feel the weight of the problem there where if you ask, what's the point of a startup? It's like, well, if someone's already attacking that problem and they're doing it really, really well, I mean, that's not really interesting for me to kind of be the me too or the jump on the bandwagon of that. Whereas when we saw what was happening in this space, we didn't see beyond the personal emergency response companies, which we give credit to. I think we didn't see much that was enduring in the market. There's other types of durable medical equipment, but not much that was focusing on connected health that had actually penetrated at a substantial enough scale that we thought, I think that's where we saw a huge blue ocean for us to attack. And then kind of combined with that, I don't want to say everything was neat and clean from the founding story. I think it's always easier to make a founding story sound cleaner in retrospect. We did have things come up in terms of how we got funded. We raised a lot of funding from the National Institutes of Health, which did kind of guide our roadmap. We got funding from the National Cancer Institutes, actually. And a big reason for that was because they were very interested in kind of the same question that our CTO was interested in, is how do you move technology from the research space to the home? And how do you do it in a way that's unobtrusive, where you can perhaps monitor basic things, do things like anomaly detection around sleep and activity, and kind of do that in a way that's simple for the consumer. So that's where there was a meeting of the minds for all three of the co-founders, is that this type of work that was happening in the research setting had to find its way into the home. And the timing just worked really well. So hopefully that answers the question of, why did we go into this space that was kind of atypical of maybe younger entrepreneurs?
No, that's great, Dom. I'm going to hand it back to you in just one second. I had one more follow-up on that. When you guys were doing all these observations and you were getting closer to a product market fit, was there a runner-up for what you guys were doing right now? Or did it become very clear through all the observations you guys were doing in your homes that you're like, no, it is this? Or were you like, man, it could be one of these two? Which one do we do?
Yeah, actually our very first play was not actually with older adults. In 2010, it was actually with the wellness space, the self-insured employer market, using, sensors similar in form factor to the ones we had. But we tried to run very quick rudimentary tests. We managed to convince a Fortune 500 bank to at least pilot it with us. And I think a lot of it was for kind of the usability, learning about the usability, not necessarily having the business model completely fleshed out. But I think that what we came away with from that was the self-insured market was very much an infant market. It was not really as exciting to us as the older adult market. And I think just the catalyst of market forces kind of moved us into, there was like an inertia towards the older adult market as we explored the space. And I think I remember a day we were sitting in a very small office. It was the three of us. And I think we just had that moment of, we all had stories from our personal lives where we were like, we don't know what's happening with our grandmother, whether they were in India, Egypt, or Iowa, which is where the three co-founders are from. And so I think we all kind of were like, well, we always saw those commercials, and there must be a deeper opportunity there. And I think that was the one thing that really kind of stuck out, is that there was an enduring market that had persisted for so many years. The business model of the basic products in that market were established. And so I think we kind of piggybacked on that side of it. And then we're like, we can do this better, cheaper, faster. And so, it didn't happen on day one, but I think the observational learning, we were very committed to learning as quickly as possible. And I think this is not my wisdom, but I think that the whole wisdom of fail early, fail often is so critical. And the deeper the failures, the better. We were very willing to embrace complete failure at that stage. And I think you have to be, and you have to have a thick skin in order to kind of get over those initial hurdles.
Yeah, it sounds like you took the iterative approach for sure. One of the things I was interested in when this popped up on my schedule here in my research was just the scale of the total addressable market for these types of devices.
Yeah,
I'm guessing that is what pushed you into this product category versus the other addressable markets that you were looking at.
Absolutely. So I mean, as I said, kind of 2010, 2025 bookending the baby boomer kind of the catalyst that we see in the US. And it's not just a US problem. We obviously have decided to focus at this point exclusively on the US market because it's its own beast. I mean, it's a huge market. There's a lot of friction in the market in the healthcare space. And one area where we differed, and we deliberately did this, focus differently from many of the medical alert companies, is focusing almost primarily or exclusively on managed care. We do sell to consumers. They can pay out of pocket for our services. We don't focus on it as a marketing channel. Our 98% of our business is managed care insurance. So that's Medicaid, Medicare, Advantage. And so I think that we saw those demographics, kind of like I was saying, with Obamacare being one of those catalysts for dramatic expansion of coverage. We saw that as kind of the first catalyst, and now kind of many years later, you're seeing that only grow. I mean, and regardless of your politics on this, what's happening now with new legislation is you're going to see a dramatic increase in funding for what we call waiver programs and other programs that are designed to keep members living longer at home. And then COVID on top of that, it's interesting because I know certain industries have obviously been horribly impacted by COVID in a negative sense, restaurants, hospitality, and it's tragic what's happened there. For a company like us, you hate to say that it's the thing that kind of moves you forward, but I think we see that in a positive light is that there's a lot of member needs that are no longer able to be satisfied in kind of the in-person setting. And so that really lends itself well to companies like us kind of utilizing add-on services. And I can speak about some of the things that we've really kind of embraced beyond kind of the traditional technology that we had put into the market, but that were kind of a response to COVID that I think you're going to see a dramatic rise in the years ahead. So.
Yeah, I'm kind of interested in digging a little deeper to the go-to-market strategy with the managed care aspect of how your product is issued, I guess, to the end user, right?
Yeah.
So, and kind of going back to the TAM, right, the total addressable market here. Typically, what's the uptake for if somebody's on Medicare, right? How do they get to interact with or get to be the end user of your product through Medicare? Like, what's the process like, and how do you sell into Medicare, right?
Yeah, so obviously there's a distinction between Medicare, Medicaid, and the plans we primarily work with are privately managed Medicaid and Medicare Advantage plans, and so they're getting a premium from the state, and the state, because of how Obamacare has subsidized Medicare, Medicaid. At least for the first 10 years, almost all of that funding was federal funding for these programs. So premiums are essentially being subsidized to these privately managed companies. Then they manage the services. And then there's certain ratios. And they have to obviously comply with a lot of regulations about how much is put towards services for members. I don't want to get into all the industry jargon and acronyms, which, I think healthcare folks love to kind of tout their acronyms. But I will say that the way it gets into people's hands is typically through an assessment. So the assessment happens, nurses go into members' homes, they do an assessment, they essentially evaluate what services members need. This is true on Medicare and Medicare Advantage. Among those services, one of the services that's often featured is personal emergency response services. And so kind of thinking about that, when we were kind of looking at the space, a big proposition that we made to the insurance plans was, okay, you're already referring services like these. Medical alerts, people press their button, they get help. Well, what if, given that your incentives are to keep them out of the nursing home, keep them out of the hospital, you pay the same amount for our services or a similar amount, and we'll help provide you with more proactive information to keep these people at home. And we'll share that information with the case manager and the nurse. And so when you're doing your visits, before you do your visit, you'll know information about what's happening with your member. And it turned out that care managers love this. They absolutely were like, you know what, more information in this regard is better. And obviously there's a kind of a limit to how much data and information you provide. But I think that the use cases we started to establish, they really found helpful. And I think the parameters that we were looking at, so aside from the 2-way emergency response, which we provide, we have a call center. People, if they need emergency services, they can always go there. The fact is, not everybody needs to go to the emergency room when they press the button. And then there's people who do need urgent attention when they don't press the button. And I think we were very interested in addressing all of these use cases. And so the things we really focused on early were activity, sleep, and compliance. So is the person wearing or not wearing their device, activity levels and sleep levels. And we were really not interested in activity and sleep the way that, say, a Fitbit is tracking it, which is just kind of giving you a measure of steps, a crude measure of steps, or your sleep quality, which we didn't see that as something that would be useful to our demographic. What we were really focused on was anomaly detection. And this was actually where my CTO's expertise came in extremely handy, was essentially being able to monitor activity and sleep power efficiently. So if you think about a lot of the devices on the market, after a day or a couple of weeks at that time, if you're using that device continuously, you have to recharge it. We saw that as a huge problem from a usability perspective, and we shared that with the market, with the nurses and the insurance plans we were working with. Is that what we've solved is the battery problem? You don't have to recharge our devices. We were monitoring every minute of the day, just basic patterns, very crude patterns of behavior. And we're not trying to be intrusive. What we do with that data is we say, okay, if we see something that's off the baseline, we trigger an outreach call. So our team will actually do outreach to the member. And so what we have is these two components. You have a trigger and you have outreach. And, it's so simple, but it's so important. And I think that was what was missing in the medical alert market. And it's what our clients really valued, is that, well, yeah, we want to know if something's happening in the member's sleep or in their activity, then, we want to know about that. And we have a lot of really great examples of how, in the market now, this happens on a regular basis where, issues that are health related or non-health related, our system is able to kind of proactively trigger alerts that allow us to then follow up. And then, sometimes the member doesn't need help, but oftentimes it's kind of an invitation to a conversation where it can yield very valuable information for any caregiver, whether it's a family member or a nurse. And I think that's why we were able to penetrate the managed care space very successfully, is that we said, look, we're not going to dramatically increase the cost for you. In fact, in many cases, we're lower priced than some of our competitors. But what we will do is we'll be able to add all these additional services for you and for your member that you value. And I think they were like, well, that's a no-brainer. Why would we go with the other guys that are essentially kind of offering the one option of you do nothing or you go to the emergency room? So hopefully that kind of answers the question about kind of the managed care entry.
I had a follow up to that, and I'll deviate just so slightly, but I'm curious as to, a lot of it sounds like what you're doing is monitoring. And so there's a lot of monitoring going on there. And I'm curious from maybe a little bit more of a macro vision, to what extent can you monitor? I mean, I read an article and you touched on it briefly. There was a cancer project that was earlier. COVID popped up last year. I can't help but think that there's a play for preventative measures at one point here. I don't know. Can you speak a little bit to the extent of where you'd like to see this go over time?
Sure. So I mean, I think that, what I'm speaking about with trigger and outreach is actually very much preventative. So it's essentially prior to the emergency room visit, you can identify certain patterns. And essentially the pattern is as simple as, okay, there is some deviation from someone's sleep, their normal sleep. What that does is it triggers an alert that a family member can receive, we can receive. An example recently was a member had taken off her device. And so she was someone who was always wearing her device. And so what it did is it triggered an alert to her son. And her son was like, well, that's out of the ordinary. She's always wearing her device. She didn't have her phone charged. He drove over, checked on her. It turned out she was throwing up. She mixed up her medications. She took off the device because she was confused. And what he told us after the fact was that alert saved her life because she went to the hospital. They made sure that they checked on her medications. And I think it's that kind of proactive response that's important, whether it's mixing medications, whether it's dizziness. These things could be indicative of a bigger issue, but the only way that you surface those issues is if you use some type of signature. And that's kind of how we see this, is that it's a very basic signature of a sleep pattern has changed, an activity pattern has changed, a compliance pattern has changed. And I think, when you think about the additional things that can be layered in, whether it's monitoring other types of vital information, heart rate monitor, SpO2. That's one that's, those are the kind of the standard things that are checked during health assessments, and during your PCP visits, they're checking those same things. Weight. We see those as periodic things to measure, but not things that are easy to measure continuously. And so I think we always we weigh the value of measurement against how cumbersome it would be for a user to use it consistently. And so I think we kind of settled on, in looking at kind of the usability, we settled on a few key parameters that we thought would move the needle on kind of that preventative point that you're talking about, without kind of breaking the back of the consumer who's like, well, you're not going to be able to put 10 devices on me and monitor all these things, because I'm just not going to go for that. For us, we have a very lightweight, unobtrusive, single device, kind of like the same with the medical alert, and it's no more cumbersome than that. They never have to recharge it. And I think those were kind of the factors that we consider in what we're willing to introduce for consumers.
Yeah, Sombit, all this stuff is super interesting to me. I'm a bit of a tech nerd myself in the home improvement industry. So I feel out of place sometimes, but it's helped serve me well here. We are helping the home improvement industry get more techie over time, which I think is a great thing. Streamline process, automate all these things. One of the things that stuck with me that you had alluded to earlier, and we actually had kicked off this series with Jim Greatorex from VGA Live at Home. And one of the things that his company is doing is placing people in touch with contractors that can actually set up their house so that they actually get out of the nursing home and actually live at home, and do it in a way that's safe and makes sense, right? Creating ramps, safety bars, all that good stuff, right? Yep. It seems like this is a very complementary component to that process that will actually facilitate. Because hey, if you stick grandma back at home, right, and it's all nice setup, she's got her chair ramp, she's got her walk-in tub, all that good stuff. What happens when she's alone, and what are the things that are going to happen there, and how do we monitor her, right? So it seems like, this is a huge complementary service to that from a technology perspective and just a service perspective. The thing that I would like to know is if you have any data on, how many people do you think you could get out of nursing homes that would normally be in a nursing home and stay at home by pairing those two things up? Do you have any data on that?
In some ways, there's kind of two different markets here. So, because you're absolutely right. There's a lot of opportunity with, we kind of treat those services that you're talking about, whether it's grab bars, other DME equipment, we kind of treat those as ancillary services. So, they're all kind of complementary to what we're providing. And I think that there's the market of kind of the out-of-pocket private pay consumer, many of whom, and you have companies like ADT that are getting into that space, but then a lot of independent contractors that provide those services. I think that the size of the market is huge from both a kind of a managed care perspective. I think managed care is still in its infant phase of kind of subsidizing those types of services, like but I think that the out of pocket market is still, it's growing substantially for that, and I think that the combination of those services with ours, I do think that's the future. I do see an enormous growing opportunity for the smart home, and I think as the cost of technology comes down, that's such an important part of mainstream adoption. So, like, as long as there's a huge premium on services, I think you unfortunately leave a big segment of the market out. For us, because we've been so laser focused on the affordability side of the equation and the low income market, I think you can kind of bridge those two, and that makes for the enormous opportunity that I think probably many people in your audience see, and I think we're very we're very interested in that as well. As kind of, I think for us, what's so important is delivering the best possible experience for a consumer and a caregiver. And I think that combines those three aspects of simplicity, affordability, connectivity. and privacy and all of that, because I think if you're like, yeah, well, we're going to connect all of your information up and, we'll know what you're eating in your refrigerator and all that stuff, I think you start to kind of run into a big problem. But I think that those 3 or 4 factors are the ones that I think every company that's doing home improvement should really think about, because I think there's an enormous opportunity to integrate services in that regard.
Yeah, I want to press you a little bit more though. From just a pure market perspective, I mean, when you look at your books and you say, hey, we want to grow by X percentage year over year here, I mean, you're running a business, right? So when you say, how many people do you think that would otherwise be in a nursing home being able to utilize this technology, obviously through managed care, but and that's your go-to-market, but how many people do you think are addressable that we can actually get on this and they can stay at home versus getting in that nursing?
Sure. So, I mean, if you think like, if you're saying, okay, there's 73 million baby boomers, obviously there's a segment of that that's not addressable in the US. Medicare Advantage, Medicaid, you're looking at, if you're just talking about the privately managed side, you have, roughly 30 million or so Medicaid, Medicare Advantage dual members. And I think that a part of it is kind of how much does policy and government funds kind of tie in with that? So are there subsidies for certain services, or is this all out of pocket? I think if it's all out of pocket, that number ends up being smaller. If it ends up being more managed, subsidized services, which is one of the advantages of our industry, is that we're completely covered by government subsidized funding. I think it ends up being much larger. I mean, there's no reason from a logistical standpoint we couldn't serve that entire Medicaid, Medicare Advantage population today. It's more of a question of awareness and how do you generate that awareness. But I think that if you start talking about kind of ancillary services and DME and other types of products and services, I think the more integrated those are, the more that penetration will be. But I think it's less about like a lot of that comes down to usability and affordability, I think. So like to answer your question is it really depends on if you're going to come up with a package that includes medical alert, grab bars, some other smart technology. Like if I bring all that package together, what is the usability of that? Is that something that consumers value to pay out of pocket for? I don't have, off the top of my head, I don't have the budgets for what a consumer would pay for all of that. It all depends on what it is. What I will say is that in the medical alert space, a consumer, a currently paying consumer will pay between $30 and $50 a month. On the insurance side, it's multiples above that, assuming you're doing something more proactive. But I think that that kind of is how I think about that addressable market.
That makes sense. From a partnerships perspective, I mean, does your company look to partner with home improvement companies to create that package and share clientele and go down that path so you get that one-stop shop where you can have all those things working together?
We've been approached a lot about that, and I think it all kind of comes down to the opportunity, right? So I think I'm one of those people who's like, for me, it's like I think there was a book recently written on this, and the title is "Hell Yes or No." So like, if I'm like, this is going to be a huge opportunity, and we get pitched a lot, and I think that having in the early days pitched a lot of other folks like and being told no, I think that I'm now kind of, I don't want to say we're like the roles have flipped, but we do get a lot of folks that are like, yeah, we want to sell you this and that, and we want to partner with you on this and that, and I think there are merits to all of these things. And I think it always just comes down to like, what's the opportunity cost of pursuing that path and what's the upside? So I think the answer to your question is it's just very much dependent on who that partner is, what kind of scale and distribution they're talking about. And, for us, I mean, I think that we're at a stage where, and we're able to service above the demand we have right now. And I think that's, something that we're always kind of conscious of, how do we embrace new opportunities? One of the things with COVID, for example, is that, we started to see new opportunities with, other services like, there was a big demand in certain states for things like tablets for members. So like having a member have a tablet to communicate with their primary care physicians rather than just having their phone. And one of the things we discovered in our usability and one of the advantages of our system is that a lot of members don't actually answer their phones. So like if a nurse is trying to get in touch with a member, how do they do that? And so we enabled a feature on our system where you can, nurses can call into their base station, communicate right away with a member. And that's actually turned out to be extremely useful because, members who are hard to reach, we had an example actually in Texas, a member who during that cold front that you guys had in February, the member is living in a trailer. The temperature went down to 9 degrees. We found out about this because there was a power outage. So because our system alerted when there was a power outage, we followed up and it turned out that the member needed help. And so we connected them via what we call our QMedic Direct Connect, where they were able to connect with a nurse. Their cell phone was not working because it wasn't charged. They had the battery backup on our base station. They communicated with the nurse. They found her alternative lodging. I think that those are things that, the types of services that we'd be interested in, anything that kind of adds value to that is stuff that we'd be interested in potentially partnering on. So, but yeah, the hell yes or no philosophy, I think it's such a simple thing actually nowadays because for a long time, you get very cerebral about like the partnership opportunities that are presented to you. And I think that when you're just like, there is a visceral reaction I have to certain ones where I'm like, yeah, that's a bad idea. And then there's ones where I'm like on the fence. And so the ones that are on the fence now, I'm like, I'll wait. And then the ones where I'm like, that's the opportunity right there. That's what I'd be looking for with partners. And occasionally I see something like that. And I think we're probably more of the mode right now where we can entertain stuff like that because of our scale. But I think that's kind of how I think of that. So hopefully that answers the question, the hell yes or no.
Yeah, I mean, you triggered me with Snowpocalypse there, but it's such a great story, honestly. You saved somebody's life because I know for a fact that people did die in those conditions. Unfortunately, too many people. What happened? We actually had a whole severe. We actually do this for in Florida. We do it for hurricanes. In Texas, we never expected to do it for the reason that we did. But we have what we call a severe weather protocol. So like the triggers are not always just like the health events. Like, oh, you had a flare up of your COPD. It's more like the trigger could be. Compliance could be sleep. It could be a hurricane is coming into town. We need to kind of triage this over a 24-hour period. The temperature drops to 9 degrees. We have to do something. So what we actually do in those instances is we have like a severe weather protocol that we use to do outreach to many members. We obviously try to do that in a way that's very contextualized based off the data we're receiving. But I think that's where we see big opportunities. If you deliver better experience for your members, I think you always win. And so that's the test that I would put any partnership up against as well.
I love some of the things that you guys are doing. And I know Dom will agree. We could riff on tech and you're way smarter than we are from the tech side. But one of the things I wanted to ask you as it relates to partnerships is, I hear, and I'm very naive, I won't speak a whole lot into this, but I hear the movement of Amazon getting into healthcare and Google getting into healthcare. And just these Apple's getting, I got an Apple Watch on right here, and I know they don't do exactly what you do, but I think mainstream America loves the idea to some extent of having some wearable and giving information. And we won't even touch the whole privacy health thing. That's a whole nother topic there. But knowing there's so much attention on wellness, which is just a multi-trillion-dollar industry, and encapsulates everything. When you think of partnerships, and I know you just went over like, hey, some good, some bad. What would be like the dream scenario for you, right? Like maybe this isn't something that's happening, but like when you think of all that's going on, if you had to build a partnership, what might that like no-brainer partnership look like?
Yeah, so because I'm very bullish on managed care and the growth of managed care, I see opportunities where managed care will cover various services for members who are in high need. And one of the things they do cover, but it's kind of disjointed, is transportation. So non-emergency transportation is a business that Medicaid subsidizes to the tune of $2 billion to $3 billion a year. And yet a lot of consumers are unaware of that benefit. And so they don't take advantage of it, or, there's problems with utilization. There's problems with service providers. And I won't mention names because that's not my, I won't mention the names of providers that are perhaps not performing well in the market. But, you do have, I know it sounds a bit cliche. You do have an Uberization of healthcare to a degree, that there are a number of service providers, Uber being one of them, Lyft, that are getting into this game of non-emergency transportation. There's a big question of how do those services get notified for a member who maybe isn't the one who's paying for that service, isn't provisioning that service on a smartphone. How do they get connected in with that transportation that will then be covered by Medicare or Medicaid? And then how do you handle the reconciliation of the billing part? That's something I'm actually very bullish on. It's always easier said than done. And I think we have to decide, okay, what do we execute on first? What do we execute on second? Interestingly, so that's one, transportation. Two, we get a lot of feedback from our partners asking about things like medication dispensing. Can you provide medication dispensers? Interestingly, one of the guys two of the people who came out of MIT at the same time that we did were the founders of PillPack, who I know personally. And that was a company that was acquired by Amazon for obviously a very good exit. But I think what was interesting is they discovered that the bigger opportunity was not in like the medication dispensing side, where compliance with medication dispensers is very poor. Like you could put medication into the dispenser and people just won't take it unless you have a kind of the right trigger and people are incentivized to take it. And the interesting thing about that company, PillPack, the founder, TJ, is a pharmacist. He actually did kind of a similar thing where like he spent a lot of time usability wise going into people's homes, like actually like figuring out what medications people needed, like color coding it so that their packaging would be such that people would find it easy to take their medications. They would know which one to take, what dose, etc. And that's what they did. They partnered with IDEO to design the packaging. That was the first move that they made. It was brilliant. Like both of the founders, Elliot and TJ, are brilliant people. And I think to me, it spoke to the usability point, is that these companies were, this company in particular was one that nailed the usability for consumers. And I think that's why Amazon loved it. And I think when we think about the things that we would value, it would be partnerships like that, where there's an opportunity to improve adherence for medication, which is the use case is complementary to the services we're offering. Transportation for people who aren't visiting their PCP between emergency room visits, and so as a result, they're delaying that PCP visit, and that's costlier to the healthcare system. So managed care. That's the crazy thing. Managed care wants to spend billions of dollars on that because they'll save even more billions if they can solve that problem. And so I think that's what gets me super excited, is that when I think about the opportunity, and it's why we actually have deliberately steered clear of consumer opportunities. It's not because there isn't a big market there. It's more that like you have to kind of pick which one to focus on. And I don't think you can really do, your audience can take this or leave this as advice. This is what I've felt, is that if you try to focus on both in healthcare, you will fail. If you focus on one, you'll still probably fail. But I think that you have a better opportunity of just being able to deliver something that matters. And so I think that's kind of the general approach we've taken. And I'd say those are the two examples. Something with medication adherence, pharmacy, e-pharmacy, and transportation are the two types of things we would see huge opportunity, in part because the Medicare and Medicaid dollars are firmly behind it. I think things like the ancillary services that you've spoken about are great. I'm a huge fan of grab bars. In fact, I wish that Medicare, Medicaid would say, okay, for everybody who gets a medical alert, you should also have a grab bar installed into your home, and we'll cover that. And I think that the easier that financing is for those types of services, the bigger the opportunity will be. And I think that's something that we factor in as kind of the budget for those things. So hopefully that answers your question about the types of partnerships we like or are open to. I would never turn anything down outright, mainly because I've been wrong so many times that would be silly too. But yeah.
No, that was great. No, I could tell you lit up a little bit as you were talking about this.
It's weird. People are like, "Why do you love transportation so much?" I'm like, I mean, I think it's because you see it working so well for consumers who are like, "Yeah, I will." I mean, before COVID, it's like you press Uber all the time. You'd probably max out on Uber, and you're like, "Well, okay, you possibly don't even need Uber. You can use a vehicle. You can use public transportation." But like these other people who like, they're sitting in their homes, they're isolated, they are not going to see people at all. And so it's a tremendous problem from a healthcare perspective that, I mean, I think that's why Uber and Lyft have gotten into that world and have kind of, and I think you are starting to see them claim more Medicare and Medicaid dollars. I don't know the current status of how much funding is coming from government funds for them, but it'll only increase. And I think COVID will only accelerate that. So
there's a lot to unpack and all of that stuff here. And we're running out of time here. So before I try to get on Chris's emergency contact list for when he his little watch sensor senses he falls and almost breaks his hip. You are getting older, Chris, so you can call me.
Not that old, Dom.
You can have your watch call me. Let me know. I just want to know what's next for QMedic. What's your growth path here? How do you get to be the primary company that the managed care professionals reach out to?
I think a big part of it is, I mean, our clients, the ones that we have, love us. We're now nationwide, so we're in every state. But with managed care, we're very active in about 20 states right now, and so we partner with all the Fortune 500, Anthem, Centene, United Healthcare, Aetna, and so I think that obviously generating awareness among care managers is a big part of our marketing. That's where we've been very focused, and I think delivering a very, very strong member experience is so important. So like the examples I gave you, like the woman in Texas, that's something that's happening regularly with our system that I think when care managers see that, they're like, yeah, well, we have to use QMedic. These guys are focused on our members. They're delivering constant updates on our members that we care about. I'm a big proponent of I mean, I'm sure everyone says they want to do authentic marketing, but I don't like just kind of messaging care managers about like, hey, like here's a useless new feature that we're adding and we're trying. I think we want to kind of make everything in our communications member centric. And I think we found that historically worked for us in terms of, where we want to, I mean, I think like many companies, we want to be doubling every year or more. I think COVID for us has been, there was a little bit of a reset at the beginning where I think our partners were trying to figure out what was happening. Then we saw a major growth towards the middle of last year. And I think that, we as coming out of COVID, with new policy changes and new funding coming into the space, we expect more catalysts for the market. And as I said, we're coming towards that bookend of 2025, where it's just going to be a perfect storm. It started with a perfect storm. I'm not saying we're going to end in 2025, but I think that there's a real huge need for caregiving that's only going to increase. And so we see opportunities there. As far as growth, we do get asked about growth outside of the U.S. Those are partnerships we're open to. I think that there's always just the question of being able to focus and deliver a superior member experience. The interesting thing is that our system literally could work anywhere. So like we use 4G services, all it would require is that you use a local telecom provider, but you could essentially put a device anywhere in the world and you could connect with anyone over it. So instead of having, say, connecting to a call center, we can route call. We're able to do this today. We can route calls to the nurse. If you say you were Chris's caregiver and he was alerting you, Dom could be the one who comes over the line and gives Chris help. And I think those are, I think those are
that guy.
Yeah, exactly. So we could.
Telling you.
we could service that need right there. And I think but we do see that opportunity because, globally, a lot of the time we hear points about, insurance isn't big in certain countries. And so a big part of the burden falls to the family. And that's something that we can deliver on. So it's, I'd say those are really opportunities that we'd explore in the future and where we see growth catalysts.
Well, Sombit, I really appreciate all the insight, and it's just your product's super exciting. And the marketplace itself is just unbelievably huge for this type of technology and all the complementary services. So for our listeners out there, I mean, this is the tip of the iceberg, it seems like, for this market segment. So that's our time today. But again, Sombit, I want to thank you so much for being here with us.
Thank you for the invitation. It was nice to talk to you guys, and I'm excited to hear more about kind of the other companies that are in your audience, and obviously happy to answer questions. But yeah, thank you.
Yeah, absolutely. We'll stay in touch, and we'll continue to share some stories here, and maybe get some partnerships going for you as well. We've all got some aging folks in our families, and we want to keep them safe and happy in their house. So it's a huge one for me. But thanks for listening to the Built Better podcast. So before we go, show some love for your favorite podcast by leaving us a review on Spotify and Apple Podcasts. And we will see you next time.